In this video, you will see a sample role play based on the role play card which has appeared in the OET exam held in August. The setting is an emergency department wherein a 34-year-old who has received suturing for a cut on the palm is being seen by a nurse to provide advice on post-discharge care. This is the recording for Occupational English Test, and the test is held at Medcity International Academy, Kannur on 19th August 2024. The candidate's name is Sangeeta Gopi and the candidate number is 2843. The interlocutor is Roshni and the interlocutor number is 9263. This is role play number 1 for the profession of nursing. Good afternoon, Sangeeta.
Good afternoon.
May I see your identification, please?
Yes, here's my passport.
Okay, here you go.
Thank you.
This is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally. We will move on to a warm-up session to get you started. This is not in any way assessed. Okay, Sangeeta, tell me, what is the best thing about being a nurse?
Well, the best thing about being a nurse is that you can reach out to so many people, you get to know their lives, and most importantly, you can help alleviate some of their pain or suffering.
Okay, great. And what do you think is the most challenging aspect of being a nurse?
Oh, there are so many challenges. Sometimes the pain that I get to see, just transcends into us so much that it becomes difficult for a person as a nurse, to lead a normal life. And the duty hours, the kind of hard work that you need to put in. Sometimes you lose out on your sleep, you miss out the right, timing for food. So challenges are numerous.
Okay, I understand. And one more question. What advice would you give someone who is deciding to be a nurse?
Well, definitely one thing I'd like to share is that be a nurse only if you're ready to be one, because it requires both your mental and physical resources. So you need to put your heart and soul for that. So just if you're ready for that, that's the only time you should choose to be a nurse.
Okay, great. That's the end of the warm-up session, and now we shall move on to the role play. I'll be taking the part of the patient and you take the professional role. The role play will last a total of 5 minutes and you'll be given 3 minutes to prepare for the same. The role play intends to get evidence of your ability to perform effective communication with patients. Do you have any questions?
Not at the moment.
Okay, so you'll have 3 minutes to prepare for the role play. You can make notes on the role play card if you wish to do so. Here is your pencil and here is your role play card. You must return the card to me at the end of the session. So your 3 minutes of preparation time starts now.
What should I address you as during the role play?
You can call me Alex. Okay, so that's the end of your preparation time. The role play will last 5 minutes. Don't worry if I stop you when the time is up. You can begin now.
Okay. Hello, Alex.
Hi.
How are you feeling now?
Yeah, I feel relieved that my treatment is being done with.
Yes, I'm glad you're relieved. I mean, when you were brought in this morning, you looked all scared and worried.
Yeah.
And I perfectly understand what you've been going through. But you look much better now.
Okay.
And there's good news. I hope you're already aware that you will be discharged shortly.
Okay.
You will be going home.
Okay, I'm really happy about that.
Yes, and I'm here to talk to you about that, what you should be taking care of once you're at home.
Okay, fine.
Okay. Before I begin that, do you have anything in specific to share with me, any concerns that you might have?
No, nurse, nothing in particular.
Well, just because of the injury, for the next 1 to 2 days, you might have slight swelling in that particular area of your palm. It might be red at times, and sometimes it could also be slight bleeding, but that's quite normal. There's nothing to worry much about it.
Okay.
But, okay, let me also tell you at the same time, if you feel that the stitches that have been just sutured now, if it comes off, you feel the stitches are removing, or if you feel there is excessive bleeding, that's the moment when you need to immediately come to us and seek medical advice.
Okay.
Okay? Right, so is that clear?
Yeah, the information is clear, and I'll make sure to see the doctor if I have any concerns.
Okay. All right, so Alex, since I've briefed you on what are the different things you should be careful about, I'm now going to talk to you about how you should be taking care of that area, the wound area. So before I start, do you know anything about what you should be doing to be careful?
No, I'm clueless.
Okay, no problem. I'm here to help you. The first thing you should keep in mind is to keep your wound, that area, dry at all times. All right, and check every day. And you know, if there is, like I've mentioned, the bleeding and the stitches being removed, check if anything of the sort is happening there. So daily checking your area of wound is of utmost importance. And whenever possible, I would recommend that you keep your hands elevated. So probably you can use pillows or cushions. Do you have some at home?
Yeah.
You have, right. So, you know, when you are either watching TV, when you're lying down, probably even while having food, if you can keep your hands elevated, that would be great.
Okay.
All right. And do you feel some kind of pain now?
No.
No.
Mild pain, that's
Mild
manageable.
That's great. We've also prescribed certain pain relief medication, which means you need to take that medicine only at times you feel that there is extreme pain, something that you cannot tolerate, just pop in a pill.
Yes.
All right?
Yeah.
Yes, am I clear so far?
Yes, clear.
Do you have any questions that you need to ask me before I move on?
Well, I have a concern. You've already stressed the importance of keeping the wound dry.
Right.
But I'm a very messy person. Just in case the wound gets wet, what should be done?
That's an excellent question. Sometimes it would happen while washing hands that this area becomes wet. If at all it becomes wet, what you need to do is immediately remove the dressing that is right now in place, pat the area dry, maybe with a fresh towel, and apply a new dressing. And don't worry about the new dressing, we'll be providing it with the other supplies that we'll give you.
Okay.
Right?
Yeah.
And yes, so I think I've covered most of the part of how you need to take care of the wound, plus the dressing in case it gets wet. Now, do you have any further questions that you'd like to ask me?
Yes, actually. I remember the doctor mentioning that my cut is quite deep and there is a possibility of the nerves and tendons being damaged. So I would like to know more about that.
Well, that's a genuine question, and I'm glad that you've put a lot of thought into this already. But I'm afraid I'll not be able to clarify that at the moment. That is something you should be checking with the doctor. Now, if you want, I can make arrangements for a discussion with the doctor. He'll probably be here before the discharge.
Okay.
Else, your follow-up appointment is in the next 10 days.
Okay.
You could also have a detailed discussion with the doctor during that time.
Okay, fine.
Would that be fine?
Yes.
Okay. Okay, Alex, so all set to go.
Okay, Sangeeta, that marks the end of your speaking test. Please return the role play card to me. Thank you very much.
Thank you.
Medcity International Academy. Trusted hands forever.